All right, thank you all. Oh yeah, let's get kicked off.
Sounds good. Thanks so much, Ben. And thank you to our panelists and all of our agents and connectors that we have on the call. And welcome to or let me backtrack. Hopefully everyone has had some time to review some of these Zoom tips here we have on the screen. So this is a webinar format, so all participants that have joined are muted. So if you would like to ask any questions, you can go ahead and select that Q&A icon. The raise hand icon is not available for today's session, so please refrain from using that. And the best way to get your question answered would be using that Q&A box, not the chat icon. But if there's any questions about that, go ahead and drop that in the Q&A box and we will go ahead and get kicked off for today. So welcome to our issuer office hour session. Cannot believe it's October. The year has flown by. So for our agenda today, this will be a 3-hour long session. We will talk about all the topics that you see here on your screen. So we'll start by kicking off our plan year 2026 landscape. So just an overview of those federal drivers that we've discussed and just making sure that no one has any lingering questions as we go into open enrollment. Also talking about the issuers available and the issuer service areas for this plan year. Then we'll go into our pre-screening tool, give a few tips and links on how to access that. And then we'll go into our issuer presentation. So our issuers have graciously developed content that they'll present on and make sure that they're able to answer all the questions that you all have. And then we'll wrap up with the closing survey as well. This is a new activity for us this plan year, so just wanted to make sure that it has helped you all understand the coverage available, engaging how you all feel going into open enrollment. So the goal of today's session is really just to highlight available plans for you all. And then our issuers will present on the plans they have available, what is in or out of network, all the services that are covered, some of the tools and resources, and the point of contact from their issuer organizations if you all have any questions. And we will allot 20 minutes for each issuer to present their content. But any questions about any of that before we dive in? All right, seeing none, I will go ahead. So for our plan year 2026 landscape, we quickly wanted to touch on these 3 primary drivers of those federal changes that impact Connect, Kentucky state-based marketplace. So many of you all have joined us for our in-person training sessions and our HCA changes office hour. So you know that there's plenty of resources on KHP's website, whether that's fact sheets, and you can always reference those recordings and meeting presentations on the facts and resources tab there. But here we just want to give a brief overview once more. So we have HR 1, or the One Big Beautiful Bill Act. This was signed into law on July 4th of this year. It introduced some special enrollment period standards, revised some eligibility criteria, and also added a few other provisions that are set to be implemented over the next 3 years. And wanting to really highlight again that that's over 3 years. Not everything is an immediate change. Many of the things that we'll be going into for plan year 2026 have not changed very much from plan year 2025. These provisions impact marketplace coverage, which includes Medicaid, SNAP, and a few other programs that agents and connectors help residents enroll in. And I know we have had a few questions about what's going on with the federal shutdown. And so we have went ahead and linked the federal government shutdown fact sheet at the bottom in that please note box. We will be distributing this presentation. So you will be able to click all those links. And thanks, Ben. I see he's already dropped it in the chat as well. So if you have any questions about certain programs or what the shutdown means to you and your residents, you can go ahead and read through some of that information. But moving on, we also have the CMS Integrity and Affordability Final Rule. So this was published on June 20th by the Centers for Medicare and Medicaid Services. We've linked the full final rule here. but this included some provisions that affect health insurance marketplaces like Connect. And because of a federal court injunction that occurred on August 22nd, many of those sections were halted. So we have also linked that as well if you wanted to explore those provisions that were impacted. And lastly, wanted to wrap up with the enhanced premium tax credit expiration. So HR 1 did not extend those tax credits, so they are still set to expire on December 31st, if there's no congressional intervention. And at this point, approximately 85,000 residents do receive enhanced premium tax credits, so they would all be impacted by that change. And depending on household size and income, some residents may lose financial assistance, but they would always be able to purchase and enroll in a full price plan. And many of these increases that we'll see can range from $50 a month of an increase to $100 or $500. Just depends on that household size and income. But any questions so far about any of that? And I know we have a long session for you all, so I'll keep it rolling. All right. So the issuers we have available today span over our QHP, vision, and dental for this session. And then we'll have a session tomorrow on our MCOs. So for our qualified health plan issuers, we have Ambetter by WellCare, Anthem, Passport, and Passport by Molina. Our MCOs that we'll hear from tomorrow will be Aetna, Humana, Passport by Molina, United Healthcare, and WellCare. And then our vision issuers include Anthem and VSP or Vision Service Plan. And then our dental issuers, we have Anthem, Best Life, and HRI Dental. So each of these issuers are panelists today. So thank you all panelists for attending as well. But we'll hear from all of them about their covered services and things like that. All right, so I wanted to just take a look at that issuer landscape for plan year 2026. So those that are expanding include Ambetter and Molina. So Ambetter is expanding into Christian County, and Molina is expanding into Bourbon County. For those that are exiting, we do have that CareSource will be exiting the Commonwealth. Members will receive notifications from CareSource directly, as well as a personal phone call and notification from KHB as well. And then we have one issuer that is contracting. So that is Molina contracting from 25 counties. We've listed all 25 there for reference. And also want to call out that 11 counties in Kentucky will have Anthem as their only issuer. So if you have any questions about that, we will talk about that a little further as well. But yes, we have 11 counties that will be Anthem only. All right, so looking at our service areas, this map here shows the combined service areas for plan year 2026. So these are all participating QHP issuers. So as you see on the screen, we have Molina in yellow, Molina, WellCare, and Anthem. And then in green, we have WellCare and Anthem. And then in that light blue color, right there in the middle of that cluster there, we have Molina and Anthem as well. And then the darker blue is those counties that are Anthem only. So that is Fleming, Graves, Grayson, Harrison, Marion, Mason, Montgomery, Pulaski, Robertson, Rowan, and Wayne. And if you want to download this map or have a better viewing here, we have linked it below as well. And you can find this on KHB's website. All right, and moving on to our Anthem service areas. So here we have Anthem Pathway service area in yellow, and then we have both the Anthem Pathway and Transition in blue. And again, for better viewing or to download it to your local device, you can click that link there below. All right. And lastly, we have our dental service areas for plan year 2026. So the light blue color, we have Best Life, Anthem, and HRI Dental, formerly Paramount. And we have in the yellow Anthem and HRI Dental as well. And again, for easy download or save, you can go ahead and click that link at the bottom. All right. Well, Ben, I'll pass it back over to you to review our pre-screening tool materials.
Thanks, Aaliyah. And again, good morning, everyone. Just wanted to quickly alert everyone to the pre-screening tool available through Connect, which is available to quickly and anonymously browse available plans. And so on October 15th, those Plan Year 26 plans became available. So you can use that to enter some just very basic information regarding your household size, income, and circumstances to get an early view of those ahead of the open enrollment period. Do want to call out that it is preliminary eligibility results and not a guarantee of coverage. So, of course, in order to be able to assess true eligibility, you would need to complete a full benefits application for those respective programs. So the Connect Benefits pre-screening tool you can use to assess eligibility for Medicaid, SNAP, CCAP, KTAP, and a bunch of other of those assistance programs available. Or you can utilize the Connect Health Coverage pre-screening tool to assess potential eligibility for QHP, APTC, and CSRs. And those help reduce those out-of-pocket items such as deductibles, co-pays, co-insurance, etc. So just wanted to alert the group here. Again, that can be found on the Connect website. So that's connect.ky.gov/benefits for the Connect Benefits Prescreening Tool or connect.ky.gov/health coverage for the Connect Health Coverage Prescreening Tool. And again, those opened 10:15 for kind of a sneak preview, if you will, of those plans available for plan year 2026. So with that, I will go ahead and kick us off into our issuer presentations. So up first, we have Ambetter, and Jeremy, I believe we have online to talk through those offerings. So Jeremy, over to you.
Thanks, Ben. Good morning, everybody. We can go to the next slide. And you can skip this one and go on to the next one. So good morning, everyone. My name is Jeremy Gillespie. I work for Ambetter Health out of our corporate office. Our offering in Kentucky is Ambetter from WellCare of Kentucky. I work with navigators in about 27 of the 29 states that we offer plans, and so pretty familiar with the work that navigators do. I also make the training materials for both our broker and navigator partners. So the slides that we have here today and then the slides we have for our brokers, or for specific broker trainings, I kind of made this deck with both audiences in mind, but we do also have like a deck that our broker sales team uses. A couple things I want to just say at the outset. One is that, especially for like the navigators here, I know you're not too focused on our success on the marketplace, but we are the -- issuer on the health insurance exchanges nationwide. So both that's a combination of our state-based presence and our FFM presence. We've got almost 6 million members nationwide. The thing I want to call out here on this slide while we have the national map up is that we have, so an Ambetter from WellCare of Kentucky member can see an in-network provider anywhere we offer plans, excluding California and New York. So I want to call out the fact that those two states are excluded from our cross-state network reciprocity, but the 27 other states that we have, and Ambetter from WellCare of Kentucky member can see an in-network provider in any of those other service areas that we offer plans. So I want to think if there's anything else I want to say on this slide. I don't think so. We can go on to the next one. And so going to give you guys some updates both for Ambetter from WellCare of Kentucky and then at the national level too. So for Ambetter from WellCare of Kentucky specifically, we're going to have a new asthma COPD care silver with a $0 drug option available for plan year 2026. So really excited about that. Aaliyah mentioned this before, we're expanding into Christian County in 2026. That's going to be our one new county for Kentucky in 2026. We've redesigned our Find a Provider. We're in the process of actually launching it right now, but I have some screens here that I took from a test environment that hopefully are going to look pretty similar to what's in the live environment. So we'll go through that in a little bit. Knowing that you guys are going to be putting your clients in different plans and with different carriers, I just ask if you enroll someone with Ambetter from WellCare of Kentucky, please mention and have them download the Ambetter Health app. One of the things I've learned from working with navigators all over the country is that so many of their clients are very low income and they don't have the internet at home or a computer at home, but they have a smartphone. And so we found that this really robust app that we developed and released last year has resonated pretty strongly with our members, and we've only continued to add functionality to it. So if you do enroll somebody with Ambetter from WellCare of Kentucky, please mention the app. And the same thing with our My Health Pays rewards program. This is really great for earning rewards for taking members can earn rewards by taking really just a few easy steps and getting some preventative screenings and then doing online activities each month. We'll talk about it in a little bit, but it's available on all of our plans, this rewards program called My Health Pays. Then we also have a perks program that just gives discounts on like travel, movie tickets, auto insurance with freeway insurance, a lot of different discounts with the perks program, which is part of being a member. And then we have virtual 24/7 care available on many of our plans with a $0 copay. It's going to be available on all of our plans, but on many of our plans, it is a $0 copay. We can go to the next slide. So Leah already touched on some of the kind of big national changes that we're tracking, so I don't want to spend a ton of time here, but just to kind of reinforce what she said, the low-income special enrollment period ended on August 25th, so we know that it's going to be harder to get an SEP, qualify for an SEP next year. So really, I know everyone on this call is pretty plugged in, but I just want to reinforce how important it is that everyone takes advantage of open enrollment to sign up. Knowing that the rules are going to be more strict during the special enrollment period next year, it's going to be harder to qualify. It's super, super important that everyone takes advantage of open enrollment and gets signed up for a plan this year. Again, I think for this audience, you're pretty much probably like, yeah, no kidding. But I just really want to restate that though too, because I just think it's so important for this year. It's important every year, right? But this year I think it's going to be especially tough. Thanks, Ben. You're reading my mind. Next thing I quickly want to touch on is the fact that those enhanced advanced premium tax credits are expiring. Aaliyah touched on this. It's a huge part of the government shutdown that's going on. We may see some changes. If we do, we'll communicate that, but we are operating with the understanding that these enhanced advanced premium tax credits are going to be expiring. And so, there's a good chance that your clients are going to see an increase in their premiums. And so there's a lot of conversations that are going to have to be had. And if we can be of any assistance in that process, please let us know. We can go to the next one. It's all pretty straightforward. The only thing I would say around open and, really important open enrollment news, obviously it starts November 1st. Everyone's plugged into that. I think the first big deadline, though, is December 15th. That's the last day to enroll for coverage with a January 1st effective date. So anything submitted from December 16th to January 15th will have a February 1st effective date. So, we don't want our members to miss any coverage or have a gap in their coverage. So that first enrollment deadline, December 15th, is a big deal. Obviously, you guys know this. You guys have been doing this for a while, at least, know how difficult it is around those open enrollment deadlines. And so, we're doing everything we can to encourage our members to get engaged and get enrolled early to avoid kind of the log jam that happens around those early deadlines. So again, I know you guys as navigators and brokers are really working hard to spread it out the same way. So just we're in this together, I guess. And yes, it's going to be a challenging year, I think, but December 15th is really the first major milestone in my mind for open enrollment. Go to the next slide. Skip this. So just a sample renewal letter that we sent out. So these are the renewal members or renewal notices for the bulk of our membership are going out here in the end of October. That's when we'll be sending them out for the bulk of our membership. For a small group of membership on plans that are discontinued. So every year we have a few plans that have really low membership that will get discontinued. Not every year, but oftentimes we'll have plans that just have, few hundred members or something like that, they get discontinued, and then the membership on those plans gets rolled into a really comparable plan. And so those notices went out in September. I don't think it would affect many or any of the clients that navigators would have been serving. Brokers, maybe a few clients might be impacted, but they're going to be plans that are very low membership. Everything we're doing this year, we kind of have this checklist style format though. So these renewal letters, the sample you see here, we have this, and then on our welcome letters, which I'll show you in a little bit, we also have this checklist style format. We can go to the next slide. I touched on the fact that it's going to be tougher to get an SAP next year, and just want to give an example of some of the binder payment reminders that we send out. Obviously, policy is not effective until the first month's premium is received, so we do everything that we can to get your clients and our prospective members to make their binder payments. Obviously, if they miss that, they put themselves kind of at risk of those really tough, the increased scrutiny for the special enrollments for next year. So again, this is going to be a really important year to take advantage of open enrollment and get those binder payments in on time. And we're going to do everything we can to notify your clients, either with texts or emails or voicemails, depending on what communications they opt into. Go to the next slide. So yeah, I touched on this before with the member information packet. Also, we're going to have this checklist style format. Just want to help you guys in helping your clients manage expectations. The way our policies work, or the way the materials work, when somebody submits an application with us, we send them a welcome letter and a billing coupon, and then when they make their payment, that's when we send out their ID card. So when they make the binder payment, it's at that point that we'll send out the welcome packet and the ID cards. And those usually, they can expect to receive those about 7 to 10 days after they submit that binder payment. We can go to the next slide. You can skip this. So just a quick snapshot of some of our key providers here in Kentucky. Ben and Ali are going to be sharing these materials with you guys, but yeah, a little snapshot here of some of our key providers in Kentucky. We can go to the next slide. Yeah, so I mentioned before that we're going to have virtual 24/7 care as either a copay or a no copay option on all of our plans for Kentucky in 2026. Nothing's going to ever replace the in-person relationship with a provider for many members, but this partnership with Teladoc Health, I think, is really great for rural, outlying areas. If a member's traveling outside of our service area, if they're in Montana where we don't offer plans or something like that, I think this can be a great option for non-emergency care needs. Yeah, the virtual 24/7 care, like I said, is available without a copay on many of our plans, and will be a copay on a few of them. We can go to the next slide. So I touched on the network reciprocity, but that's one of the big things I think I always like to call out with our premier portfolio. This is the only portfolio that we offer in Kentucky on exchange. So like I said, an Ambetter from WellCare of Kentucky member can see an in-network provider anywhere we offer plans, excluding California and New York. I'm from Chicago, Illinois, which is Cook County. If an Ambetter from WellCare of Kentucky member was traveling here and wanted to see a network provider, they could do so because we offer plans here in Cook County and Illinois. We have adult vision and dental buy-up available on all plans. Members don't need a referral to see any in-network provider. And again, this is going to be available in all of the counties that we offer plans in Kentucky. We can go to the next slide. I think that's the county map. Yep. It's our footprint for 2026. We've got a great county coverage list here for 2026 in Kentucky. Christian is the one new county. So welcome to the family, Christian County. Happy to have you in our network. Excited to speak with anyone down the road if you have questions or need help in the new county, but we're really excited to be expanding there. We can go to the next slide. This is just kind of our portfolio at the highest level. We've got a HSA compatible bronze plan called the Choice Bronze, Everyday Bronze, which is a bronze with some copays. for like office visits and specialists, primary care and office and specialist office visits. Got 4 silver plans, the Clear Silver, Complete Silver, Focus Silver, and Enhanced Asthma COPD Care Silver with $0 drug options. And then 2 gold plans. We can go to the next one. Just going to kind of breeze through the, these will be shared with you. This is the everyday bronze. So I think this is a good bronze option. We encourage everyone to look at a silver plan first because of the cost sharing reductions that are available on silver plans, which, are driven by household income, family size, and zip code. But for, folks who don't qualify for those, sometimes a bronze plan is the best fit. And so we do have this everyday bronze with primary care office visits covered by a $40 copay, specialist by a $90 copay. We can go to the next slide here. This is the Focus Silver. You can see it's got a $0 deductible, the 2 highest cost sharing levels. We broke this slide out to the different cost sharing variations of this plan. So those of you who've done this a long time be pretty familiar with this, but there's cost sharing reductions that are only available on silver plans. And what will happen is you and your clients will see the version of the plan which they qualify for based on their household income, family size, and zip code. So they don't have to sort through the different versions of these plans. They'll see what they qualify for based on those inputs you put in the connector. But yeah, I don't want to sit here and talk about product grids too much. We can go to the next, or plan grids, excuse me. We can go to the next one. Quickly, I want to talk about the vision and dental add-on. So these 2 benefits are offered together. They can't be purchased or added on separately. They only come together. And they can't be added on later. So, for example, I just showed you the Focus Silver. If you had a client who wanted our vision and dental add-on with it, you would select the plan that says Focus Silver plus adult vision and adult dental. It'll be in the plan name. So our vision and dental cannot be added on after they've selected a plan. Specifically for the vision here, there's no waiting period. It's for members 21 years of age or older. Glasses or contacts are covered, not both. So the member can either choose to get glasses, in which case the frames are covered up to $130. If they choose frames that are more expensive, they'll pay the difference. And then the frames, or the lenses for those frames, whether they're single, bifocal, trifocal, or lenticular, those are covered at 100%. In-network providers only. Let's go on to the next one. And they can choose contact lenses in lieu of glasses. Again, the dental add-on, there's no waiting period for any of the services here. Again, it's for members 21 years of age or older. Important thing to understand about the dental add-on is that there's a maximum benefit of $1,000 per covered person per calendar year. So these out-of-pocket maxes for the dental won't apply to any of the other out-of-pocket maximum. Well, excuse me, the max benefit, anything paid towards this max benefit on the dental won't count towards the main max out-of-pocket on the health portion of the plan. Sorry, I misspoke there for a minute. In-network providers only, and then what I would say on this real quickly, routine exam, cleaning, x-rays, those all have no copay within network providers. And then more involved procedures have 50% coinsurance. That means the member will pay half the negotiated rate, and the portion that the plan pays will be subtracted then from the annual maximum. You can go to the next slide and probably, one more. There, right there. Great. So My Health Pays is our rewards program. Like I said, I know as navigators, as brokers, you guys are going to be putting people into different plans with different carriers. But if you enroll someone with Ambetter from WellCare of Kentucky, please mention our My Health Pays program to them. Each member on the policy can earn up to $500 by completing certain clinical and online activities. So on the left-hand side of the screen, I put the clinical activities, and on the right-hand side are the online stuff. So the well-being survey is the first kind of clinical activity that's done inside of the member portal or on the app, and they earn a reward for doing that. Annual well visit also is rewarded, so the annual physical. Comprehensive diabetic screening, so an eye exam, diabetes kidney screenings, HbA1c tests, those are screenings that are rewarded. And then there's certain quality measures. So for children, it's immunizations and vision screenings. For women, it's cervical and breast cancer screenings. For men, it's cholesterol and colorectal cancer screenings. And then for everyone, high blood pressure screenings. So those are kind of clinical activities that we reward. And then there's online activities that members can complete each month that are really fun and easy. They take about 10 minutes to complete. We can go to the next slide. And so the way this program works is when members complete any of those clinical activities, and also on the clinical activities, those are preventative screenings, so they're covered as part of the ACA. So like when the member gets their annual physical, that's covered at 100% because it's mandated by the ACA as preventative care. So it doesn't cost a member anything to earn these rewards, but they do have to obviously take action, right? They have to complete those clinical screenings, and then they have to, they can also complete the online activities. And when they do complete any of those screenings or online activities, they earn points. They can use those to shop an online reward store, or they can convert the points to dollars to pay premiums and other healthcare related costs. So you can kind of see here on the screen, what'll happen is we send them a MyHealthPays Rewards Visa card if they choose to convert the points to dollars, and then they can use that premium MyHealthPays Rewards premium or MyHealthPays Rewards Visa card to pay monthly premium payments, doctor copays, deductibles, and co-insurance. They can also use it for utilities like their gas, water, and electric bill, their cell phone, transportation, childcare, education, and rent. We go to the next slide. Skip this. We'll go to the next one here. I'm mindful of my time here. I saw I had a 10-minute notice. 5-minute warning here. Thanks, Aaliyah. So if you recall, I said at the outset we have close to 6 million members nationwide. I got these numbers in August, so they're a little bit out of date, but as of August, nationwide, we had 850,000 MyHealthPays accounts activated. So there's just a lot of room to grow there. So that's why I say, knowing that you guys are going to be putting your clients in with different carriers, if you do enroll a client with Ambetter from WellCare of Kentucky, please mention the MyHealthPays program. We're screaming it in the welcome packets and the welcome letters and the emails. But I just think it's different, the relationship, especially with like navigators and their clients, the advising you guys do. If you advise them to take a look for this, I think it really resonates. And so as of August, we had paid out $80 million in rewards, but there's still a lot of room to grow with this program. We can keep going here. I talked about our perks program, again, available to all members, discounts on restaurants, travel, auto coverage. We can go to the next one here. I want to make sure we get through the end here. We got the Find a Provider tool. I got the link there on the screen, and we'll be sharing these slides out with you guys. Knowing that we're kind of tight on time, I'm going to look at the chat here. We can go ahead, skip ahead. Yes, select plan year 2026. Obviously, when you're using the Find a Provider guide, please, that'll be obviously if you're shopping for 2026, I guess if you're doing a special enrollment, you'd still choose 25. But we can go to the next slide here. We just added some search at a glance options, which I think will be really helpful. It's a big challenge with the Find a Provider. So we're in the process of rolling this out right now to be ready for 1/1, and the process is going pretty smoothly. Like I said, these screens should look really close to what you'll see in the live environment. I took them from the test environment. We can go to the next one. Skip this. I want to kind of get to the end here. We've got some new sorting options, which I think will be great. Take advantage of that as needed. I always tend to say, err on the side of caution when applying too many filters. Obviously there's certain things that might be non-negotiable for some of your clients, like if the office is wheelchair accessible, but I tend to say cast the widest net as possible when using the Find a Provider guide. Go to the next one. Let's skip this. Just knowing that we're really short on time here, we'll go skip. The formulary is under 4 members, and you can kind of drug coverage right there on the drop-down box. We can go to the next one, Ben. We have a mail order prescription with Express Scripts, so members can get a 90-day supply of maintenance medications, usually less expensive to do it that way. They can have their provider send the script to Express Scripts, or the member can do that themselves in the online member account. Go ahead. I mentioned the app. If you enroll someone with Ambetter from WellCare of Kentucky, please mention the app. You can skip to the next slide, but they can do everything in there that they would do in the main member portal. So I've got my email address on the screen. I work with navigators primarily, but if you're a broker and you need some direction and who to reach out to, you can reach out to me there too. It's jegillespie@centene.com. I've got a QR code for the app stores for both the Google Play and iPhones that will take them to the app. I think that's my last slide, but just want to say how much. Oh yeah, we've got just some good links for you guys here as well. We got the phone number for member service in there as well. And then also, if you're a broker, you can call that same member service number and choose the option for brokers. Appreciate you guys. Appreciate the attention this morning. I know really busy time of the year for you guys, so appreciate you guys allowing us, Ben and Aaliyah, the opportunity to talk, and everyone for attending and all the good work that you're going to do for your clients here during open enrollment. And of course, if we can be of any assistance to you guys, please reach out to us. We want to make sure we're a good resource. So thanks and good luck during open enrollment.
Thank you so much, Jeremy. Appreciate you. All righty. Looking next, we have Anthem up. I believe Michelle is going to be presenting. Is that right?
That's correct. Can you hear me, Ben?
Yes, ma'am. Sure can.
Okay. Well, good morning, everyone. My name is Michelle Grant. I am an individual and small group account executive or sales rep for Anthem of Kentucky. I work primarily with agents directly who handle the Lexington and Eastern Kentucky markets. But for today, we will review, of course, updates pertaining to Kentucky as a whole. So next slide, Ben. Just a couple of facts about Anthem. As you know, Anthem has been a longtime trusted healthcare leader in the Kentucky market for 87 years. So we're pushing 9 decades of helping Kentuckians and are one of the most recognized and reliable health insurance providers in the Commonwealth. Looking at our market presence, we do serve approximately 45,000 individual members. So that is only members who are in the individual under 65 market. We have over 45,000 of them covered in the Commonwealth. So very large presence here. We work very hard to maintain a strong network in both urban and rural areas so that wherever the consumers that you're working with live, they have proper access to a very solid network of providers. We have long-standing partnerships with almost all Kentucky healthcare providers to ensure that broad network for members wherever they live. We have a deep commitment to our Kentucky communities. So we are investing in improving the health and well-being of Kentuckians. We have many outreach programs, local health initiatives, and partnerships with both nonprofit organizations and providers. And we support both a preventive care mindset as well as chronic disease management and solid access to behavioral health services for our members. We have a commitment to innovation, so we use a lot of data analytics and digital tools as well as AI to personalize these healthcare models and enhance the member experience so that they have an easier time navigating what can sometimes be a complicated healthcare environment. Next slide, please, Ben. So let's look at plans that are available in 2026. As you are probably familiar, we do offer, Anthem has 2 different networks available in the state of Kentucky, the Pathway HMO and the Pathway Transition HMO, which is a slightly narrower network, still including all major hospital systems, but also at a lower price point. For 2026, we will have 7 bronze, 5 silver, 1 gold, and 1 catastrophic plan in the Pathway HMO network. The Pathway Transition HMO has a similar outlay with 7 bronze, 3 silver, 1 gold, and 1 catastrophic. And regardless of which network or plan the member has chosen or is best for them from a price point perspective, on the right-hand side of your screen, you'll see several things that remain constant regardless of the network chosen, and that is the pharmacy option. It is our base pharmacy network with R90, which simply means retail, 90-day prescription at retail. So they don't have to do a mail order benefit in order to receive the 90-day supply at a retail pharmacy. The select formulary is the formulary that has been included with our ACA plans, both on and off exchange for many years and will continue to be offered in 2026. Opt-out home delivery simply means that if a member would like to receive their maintenance medications from a mail order benefit home delivered, they can do that. However, if they do not wish to fill their maintenance medications and have them home delivered, they simply opt out either via a phone call or via the Sydney app to say, I do not wish to start utilizing mail order benefits after my second fill at retail, and they will be able to continue picking up in a retail pharmacy. And lastly, the wellness program embedded in all individual plans will be the individual foundational wellness program, and we'll take a look at what that is in just a little bit. as well as the Kentucky Engagement 100, offering members up to $100 in gift card rewards. Next slide. Network updates. Our service area, as I think one important thing to call out is that Anthem has been and will continue to be an option in all 120 counties across the Commonwealth of Kentucky. The larger Pathway HMO network is available in every single county. There are 48 counties in Kentucky that offer just the Pathway Transition network, and then 72 of the 120 counties will only have the Pathway HMO network, so the larger network, whereas there are 48 counties where a member can choose either between the narrower Pathway Transition at a lower price point or the full Pathway HMO network as well. Next slide. So this is just a quick snapshot. I know you all have seen a lot of color-coded maps today. This is specific to Anthem. So when you were looking at this Kentucky map, just a quick view of those darker areas, the darker counties there, that is where you will see members that you are working with have access to choosing either Pathway Transition or Transition HMO. And then the entire state, every county will have access to the full Pathway HMO. Looking at some covered benefits, we do offer virtual care and preventive care for these members at no extra cost. So if a member is using their Sydney app, they have access to virtual care visits at no cost to them. Our prescription benefit does include some $0 copays for commonly used medications with convenient home delivery. So there will be many preventive medications that are covered in full for these members. Our Sydney Health app is available for 24/7 access to our Find Care tool, as well as virtual care and symptom checkers. Dental and vision coverage options for integrated whole health care. We'll talk about that in just a moment, but there are a couple of medical plan designs that will come with embedded dental and vision options, and that will be noted in the plan name. Mental health services are available for all members, whether they choose to seek this care in person, virtually, or using our Sydney Health app. And then special offers is an exclusive discount program that gives members discounts for health-related products like contact lenses and gym memberships as well. Next slide. In general, for 2026, just note that there are no plans we are discontinuing, and we are also not introducing any brand new benefit structures as well. And I know this chart is a beauty to look at, so I apologize. And I mostly want to show this screen simply so that you can see the wide variety of benefits that are available to our members. The bronze plans are listed first, and then it is down to silver and gold. As Jeremy mentioned, we know that many members are shopping in the silver category because of the access to cost share reductions there. I do think it's important, however, to call out that since CareSource is exiting the market, we will have a lot of CareSource members coming from bronze plans. It was a popular option there. So just know that we do have several bronze plans that offer a specialist copay before deductible, which has been important for many of our members. And the silver and gold options are available as well, with deductibles ranging from as low as $500 on one of our silver plans all the way up to $10,000. So whatever the members' needs are, there's a solid chance that we have a benefit structure that will match their family needs. Just a couple of updates to the out-of-pocket max and a few on the urgent care benefits that I need to call out. With federal updates and maximum out-of-pocket limits changing each year, we have updated some of the benefits within the current plan design. So for example, the Pathway 6700, that out-of-pocket max that was $9,200 is going up to $10,600, which you will see across the board on all 5 of the plans shown here on this screen, with the out-of-pocket update to $10,600. For the Bronze 7000 plan, that does have adult dental and vision included. This is a fairly popular Bronze plan. We will continue to offer it, but I want to point out here that in 2026, the urgent care visit will be moved to a $75 copay. Next slide, Ben. And just a couple of other updates here. The Pathway Bronze 8500, the deductible and out-of-pocket are both increasing to meet the federal limits up to 8500. And then the other important call out on this slide is that the Bronze Pathway 7000 with HSA options, the advanced imaging and ER benefits are changing from deductible and then $150 copay to a deductible and then a $200 copay. Moving on. And the highlighted copay change here that I wanted to make sure you all are aware of on the Anthem Silver Pathway 3500, that RX, your tier 2 pharmacy benefit, is moving from a $40 copay to a $55 copay. This is in an effort to keep pricing in line for that plan in general. And then the plan right below that with the Pathway 4000 adult dental and vision plan, the urgent care copay, instead of 3 visits covered in full and then $50, those will be $50 right out the gate from the beginning of the benefit. And lastly, the Silver Pathway 4200 with HSA plan, the tier 2 pharmacy copay is switching from deductible 40 to deductible and 55. Next slide. Just a couple other copay updates to call out here. The positive change in benefit, so a richer benefit will be offered on that second plan, the Anthem Silver Pathway 6000. The first tier, so their tier 1 drugs that were $25, those will actually go down to only a $10 copay for 2026. And the Gold Pathway plan with the $2,300 deductible, their tier 2 pharmacy will move from $35 to $50. Next slide. From a wellness perspective, and we'll review wellness a little more in just a moment, one important thing to note is that our 90-day wellness exam, so for the member to earn the $50 of their $100 toward their Engagement 100 wellness package, we are now giving members 120 days to do that. That is something we've heard for several years. It is hard, especially at the beginning of the calendar year, for members to always get in for their preventive exam in that first 3 months. They now have 4 months to complete that task. From a plan name change perspective, the plan themselves are not changing, but the catastrophic plans and all plans will no longer show the deductible amount or the fact that the plan is an HMO in the plan name. That is simply because all of our plans are HMO plans. While they are not gated and do not require referrals, since all plans are HMO plans, you just simply won't see the name, the HMO abbreviation in their name any longer. K Health, who was one of our participating virtual health providers, will no longer be in our network in 2026. However, members still have plenty of access to virtual care, whether that be through Live Health Online or their personal providers that may offer virtual health benefits as well. Next slide. Looking at well-being solutions, all of our individual health plans will include the foundational wellness program that many members have enjoyed for years and years, and the Engagement Package 100. Let's look at what is included in the foundational package. For the sake of time, I will not read through every single one of these, but just a reminder, this very broad wellness program is and has been embedded in all individual plans for years. That includes case utilization management, the Sydney Health app, 24/7 nurse line, which is a very popular benefit, as well as many, many clinical review resources that are happening behind the scenes to benefit these members that many may not even be aware are happening on their behalf. Next slide. The engagement package. So this is the way that our members can enjoy up to $100 in gift card rewards simply for taking advantage of their wellness exam for $50 within that first 120 days, as well as taking their health assessment online. We'll offer members another $50 as well. These rewards are issued in the form of digital gift cards, and you'll see on the right side, members can choose many retailers as far as Amazon, Target, Home Depot. There are a lot of those. They also have the option to select a digital MasterCard, so that $100 can essentially be used much like cash for anything that the member may need, whether that is paying for copays, paying premiums, anything of that nature as well. It is important to note that the rewards are forfeited 6 months after the end of a member's plan year. So just encourage those members to not only make sure that they're getting both of these tasks done to earn their $100, but that they do use that $100 or cash those gift cards in within 6 months of the end of their plan year. Next slide. Looking at some of the tools and resources that members can enjoy when they are on an Anthem health plan. Sydney is our app that all members have access to, and this is really the front door to care for our members. It guides them directly with easy to use tiles. When they log in, it will direct them to very quick to find proper care as far as their health and wellness. Digital care, a symptom checker, ID cards can be quickly accessed from Sydney Health. They can be faxed, digitally emailed to a provider. So it really helps members get the right care at the right place at the right time. We also use AI guided recommendations. So we have one of the nation's largest data sets and can help utilize some of those everyday well-being tools for the members. Next slide. Points of contact. So this is not our entire Anthem of Kentucky sales team by any means, but we want to make sure that you recognize we have many people within the state of Kentucky. We work here, we live here, that are available to help not only our broker partners, but also you all as connectors who are on the call. I am one of 4 sales reps who work the Kentucky territory. Amanda, Kathy, and Amy, who are pictured here, we all work with various brokers in the state, depending on where they are located. Erin Dayglow is our business development consultant, who is a great resource for connectors who may need any assistance or have any questions regarding our plan designs or member resources. And then our broker services team is a dedicated group of individuals that are based out of the Louisville, Kentucky office. And they are there day in and day out to answer broker phone calls as well as emails and help the brokers help their clients. Kira Little leads that team. She's an amazing resource for helping us to help you all. And again, that is all I have for this portion. I will be back on in a little bit to discuss our dental and vision offerings. Thank you so much for your time. We greatly appreciate you all, especially the connectors that are working every day with Kentuckians to help them understand what their benefit options are and navigate the changes that will be coming with many of the enhanced APTC changes. So thank you very much for your partnership.
Yes. Thank you, Michelle. And as you mentioned, we'll hear from you shortly. So
Yes.
Looking forward to that. All righty. Thank you so much. All right. Looking next, we've got Passport by Melina. So KT, I believe we have you up next.
All right. Can everyone hear me? Can you hear me okay?
Yes, sir. We're going to hear you loud and clear.
Excellent. Good morning, everyone. My name is Kasai Tafisa, also known as KT. I am in a position as a broker channel manager for Molina Healthcare, really working with our brokers, agents and agencies in quite a number of markets. And Kentucky is one of my states that I service our brokers and agents and agencies in your state. So again, thank you for the opportunity to be able to present Molina's marketplace product and services for 2026. While this presentation is going to be focused strictly on Kentucky, specifically on Kentucky, we do have ongoing trainings that are conducted on an ongoing basis by myself and my counterparts, my colleagues throughout different markets for any agents and agencies participating this morning. Certainly, please go ahead and join those for state-specific and national trainings that would give you a lot more information specific to states that you may be interested in selling. This is just really a reminder on the slide that November 1st of 2025, or same timeline as FFM states for your state, and ending January 15th of 2026. Next slide, please. So Molina Healthcare, just wanted to give a little bit of background, was founded by Dr. C. David Molina, who was an ER physician, specifically really primarily to serve the most vulnerable and underserved members of our community, specifically Medicaid and Medicare population, low-income families and children. It was founded out in Long Beach, California. We stay true today to the vision and mission of Dr. Molina, even though we are currently a Fortune 500 company ranking 125, we still stay true to that initial founding purpose of Molina, serving our underserved. We are currently serving people, members in Medicaid, Medicare, and Marketplace. Next slide, please. This is our national footprint. Showing in a gray area, we will be exiting 2 states on a national level. That would be Wisconsin and Michigan. Also exiting several counties within certain states, however, also expanding in a few of our states into additional counties. Next slide, please. This is our 2026 service area for Kentucky. As was stated earlier, unfortunately, we'll be exiting from 25 out of the 30 counties that we're currently in, expanding into Bourbon County, so in 6 counties for 2026, and then around the Lexington market. We will not be in Jefferson County or the Louisville market. Next slide, please. So Molina provides quite a range of product services for our members. Several bronze silver options, silver 94, 87, 73, and 70. These are our CSR options. And silver 94, 87, 73, and 70. These are our low cost silver option. These also do provide our members with 4 free primary care visits per year. Across all plans, members will have access to unlimited 24/7 virtual healthcare services at no additional cost, and it is serviced by Teladoc, available to all plans. Annual wellness visits for adults, routine preventative prescriptions and screenings for adults and children, routine vision exam built in with all vision coverage for all members across under the age of 18 across all plans at no additional cost. This is serviced by VSP, and it gives our pediatric members $150 in allowance towards their glasses frames or contact lenses, preventative prescription drugs, and 24/7 nurses advice line. Highlighted in the bluish color for urgent care, for example, Molina does waive deductibles on quite a number of these services. Typically, urgent care is the same copay as your PCP copay. Next slide, please. Going across all these different plans again with the CSR options on outpatient professional office visits for primary care, specialty, rehabilitative, and habilitative services, mental health. Members are able to access these benefits strictly based on copay with deductibles waived across all these plans, as well as on the CSR options, routine X-ray diagnostic services and laboratory testings will be also completely accessible based on copay with deductibles waived. Next slide. Again, as far as prescription is concerned, preventative drugs completely free across all plans. And preferred generic medication can also be accessed strictly based on copay across all plans with deductibles waived. And with the low cost silver option, with the 4 free primary care visits, preferred brand drugs will also be accessible strictly based on copay. Next slide, please. Molina will also offer gold options. So in your state, we're only offering silver and gold and no bronze options. Similarly, on these gold options, which are very rich in benefits, low deductible, do waive deductibles quite a number of benefits for our members, including primary care, specialty, rehabilitative services, and urgent care. Next slide. Continuing on this is our Passport Gold. One of these will have an embedded dental and vision option for adults, which is new. We did have dental vision option. However, dental will be a new option that would be embedded in some of these plans, both silver and gold. Next slide, please. All right, so here's our embedded adult dental benefits, strictly no pediatric dental available now in Kentucky. It is going to be administered by Delta Dental, which will offer a strong national network of Delta Dental providers. Diagnostic and preventative, completely at no charge, once every 6 months. Basic dental services, 50% coinsurance. However, when it comes to major dental services, 50% coinsurance, there is a waiting period of 6 consecutive months. Now, if an enrollee is able to provide prior coverage verification, we will waive that 6 coverage month waiting period for that individual. The max annual benefits on this is $1,000. And these services will be available with Molina's Silver Core, and the Gold 1640 plans will be the ones that will have an embedded dental option. Next slide, please. Similar to the pediatric vision, our adult vision option is going to be also serviced by VSP. There is an additional premium charge on this. Again, routine dental cover comprehensive vision exam annually, routine retinal screening, prescription glasses and frames, up to $150 for adult members as well. So great benefit included with the Molina Core Gold and the Silver Core and the Core 1640. Next slide, please. Molina has unique member services by state. I have highlighted here for you the Kentucky member services number. So let's make sure, please give your clients the Kentucky number. Okay, next slide, please. Right, so we will continue to offer the Molina Healthy Rewards program, which really recognizes and rewards members who are taking steps towards better health. Members earning up to $200 in gift card or digital or physical for making sure that they do their annual wellness assessment and make sure that they see their primary care physician in increments of $50. Anyone 18 and over in a plan is eligible to participate. This program also provides a suite of health tools and programs on topics such as smoking cessation, diabetes management, a wealth of healthy living video libraries, exercise, diet, and nutrition. So a great plan. The utilization of this plan has increased year over year, but certainly we could use your help to get our members to take advantage of these benefits. Just to mention with our teledoc earlier that I forgot to mention that mental health services is now also included as part of the telehealth virtual care at no additional cost to the member. Next slide, please. We make quite a range of payment options for our members to avoid lapsing in payment and coverage. We certainly recommend that you set up an auto pay and recurring payments at the point of enrollment. However, members do have the option of paying online through bill payments directly from their bank, by phone, by mail, but they will have to allow 10 to 15 days for processing and payments posting. They may walk into any local MoneyGram locations to make payments in person. Also, check-free payment is something that we added last year. There are some more 30,000 locations throughout the country. Members can call the 800 number listed here to find out one near them. They may walk into these locations with their invoice and make payments in person. One-time payment option, Billmetrics through Billmetrics is also available. The link here will take you directly to this site. Google Pay and Apple Pay are additional forms of payment options for members. Next slide, please. For enrollment and premium billing pay numbers, we have unique numbers per state. So let's make sure we give your clients the correct number corresponding to their state. Next slide. So Molina has an excellent provider online directory, which is really user-friendly digital experience. You are able to search for doctors by name, by specialty, by hospital, facility. The key here to mention is that since Molina has three different lines of business, Medicaid, Medicare, and ACA, let's make sure we're searching the marketplace site to make sure we're not looking at the wrong network. Members can now search, view, and complete their own PCP selection. One thing that I like to mention here is that even though we do assign members a primary care physician, we do not list their assigned member primary care physician on their card. There's a reason for that. Members can go to any in-network primary care physician as long as they have the same. The only time they really need to replace that card is if they lose it, damage it. Otherwise, they can keep the same card as they switch their primary care physician. The only way they would know if they are assigned, who they're assigned to, is if they log into their digital member ID card. If a member is assigned to a given PCP and they end up going to a different PCP that's a network, no harm done. Based on claims history, we will, on the back end, we will make that adjustment and inform that member that we have made that adjustment, and they can continue to see that primary care physician that they're seeing and keep the same member ID card. There's a QR code here that will take you directly to the site. Next slide, please. Here's our network list that are contracted to service our marketplace members. There's a new addition. St. Elizabeth is now added to the network for 2026, which is not listed here. So these are the hospitals that will service our members. Next slide, please. We have quite a number of resources for our brokers, including brochures and flyers that they can order through the Molina Marketing Store. Our broker services unit is located in Salt Lake City, Utah. This number here is not for members. This is designated for brokers and agents. Now, navigators and assisters, you're certainly welcome to call. They will assist you. They're open from 6 a.m. to 6 p.m. Monday through Friday, Mountain Standard Time. Our broker portal is called Evolve NXT. You can certainly link yourself through this or through the Molina Marketplace site, which is molinamarketplace.com. The email address is listed here for you, and these two QR codes will take you directly to the broker portal or to the Molina store. Okay, next slide. Okay, now before I said thank you again for the opportunity. This was a short presentation specifically designed for this. But those of you that are brokers and even navigators, we have kicked off and e-blasted quite a number of trainings. Certainly, please you're welcome to join those. I want to mention that commissions have not been released yet, but we will be paying commission in your state, both new, renewal, as well as bonuses for retention for our brokers. Certainly, that is great. So that should be released anytime here within the next few days. Also, I want to mention that Molina does not require referrals for any specialists as long as they're in network. A few things that I think I may have missed in this presentation. Now, also that I did mention about the member ID card. So that's it. These QR codes will take you directly there. I'll be more than happy to answer questions that you may have. Certainly appreciate the opportunity to present. Thank you.
Thank you, KT. Appreciate it. So we are transitioning now from our QHPs now into our vision providers. And so I will ask Michelle to come back on and discuss Anthem's vision offerings.
Okay. Long time no see, guys. Just a couple of updates on our vision products. I will tell you this will be much, much, much faster than our prior talk because I only have one slide for you on vision. So our Anthem's individual vision options, when they are on a standalone basis, so on Exchange or on Connect, you will see that there were several medical plans that do have a comprehensive vision benefit built in as well as a dental benefit. However, for members that are looking or needing a more comprehensive, maybe richer plan as far as lower copays for lenses, a higher contact lens benefit, those are available for members in all 120 counties to purchase. However, they need to be bought directly through Anthem, so off the exchange. Any of our licensed Anthem agents do have the option to quote these plans directly on their broker portal for the off-exchange vision options, or members can also go to the shop.anthem.com website and look for their own if there's someone who does not have a broker to work with. Just to point out a few of the great benefits of our Anthem Vision plans, we do have a huge, broad Blueview Vision network. So that includes tens of thousands of national vision providers for members to access. The plans all include coverage for yearly eye exams, certain add-ons like factory scratch coating on eyeglass lenses at no extra cost. We offer discounts for other add-ons like transition lenses, progressive and premium anti-reflective coatings. Value-added benefits like 15 to 40% off most extra pairs of glasses, lenses, lens treatments, specialized lenses, and various accessories. So these are available, these discounts, even after the member has exhausted all of their actual vision covered benefits. These discounts still remain in place to help them afford additional aspects of their glasses or contacts lens coverage. There are discounts through special offers at anthem.com for LASIK surgery, as well as other products and services to help promote their health and well-being. The members can choose from 4 different plans depending on their and their family's vision needs. So we do have the Blueview Vision Enhanced, the Plus, the Value, and the Progressive Preferred. These 4 will vary in range as far as how rich the benefits are, so how low the copayments are for whether it is the exam or the lenses or frames, as well as the price. Of course, the price point will follow the richness of the vision benefit itself. So just know that there are 4 options. It is a very large portfolio of vision benefits that members can choose from. It is just that they would need to do so off exchange if they need vision coverage that is more comprehensive than what is available on those few medical plans that have vision and dental built in. I think that's all I have, Ben, on vision.
Yes, ma'am.
Same points of contact here. Yes.
Points of contact. Yeah.
Yes.
Thank you, Michelle. All righty. Looking up next, we've got Vision Service Plan, or VSP, and we got Michael today presenting. Over to you, Michael.
Great. Thank you, Ben. Appreciate it. And yeah, welcome. Thank you very much for including me in this presentation today. Really excited to get a chance to speak with the assisters and brokers. And we've had a partnership with Kentucky for a bit. Really excited to be partnered with them and have a chance to serve members who need vision. So my name is Mike Denhan. I'm based in San Diego and with VSP. And VSP, many of your clients might have had VSP in the past and had a great experience with them. We're very fortunate to work with the exchanges because only state-based exchanges have the ability to sell it as a buy-up versus the federal exchanges. So I'm going to talk a little bit about what's offered on the Kentucky Exchange. And you see below VSP the actual link to get over to our site to help a consumer purchase a vision product. So Ben, I'm going to have you go to the next slide. Now, specifically, questions come up about when how do I approach this with consumers about needing vision? Who needs it? Why do they need it, et cetera? And the reality is, there's a mandate for children in ACA. It's embedded, they're covered, but adults, it's not a mandate. So what if the plan isn't embedding it? Adults on ACA don't have coverage and might need that. And we also know that adults, there's so many people that have a visual impairment, and so many of them are not seeking care or seeing an optometrist. So there's a whole bunch of folks that have vision care needs that don't have vision coverage. And if we go to the next slide. Specifically in ACAs, we know that's comprised of folks rolling off their parents' coverage, part-time employees, folks that may have retired early and are not eligible yet for Medicare. And so all those folks sort of fall through the cracks and may need vision care and would benefit from a fully insured product. And as I mentioned, adults on ACA, it's not mandated to include vision. So many of the plans do not include it. So one of the questions that as you're sitting down as a trusted advisor, speaking with these folks about their healthcare needs, their dental needs, and so forth, is to simply ask them, are you wearing glasses or contacts? It's really a great jumping off point. And we have heard from other assisters, they're not totally comfortable speaking about vision. They focus primarily on health, which makes sense. But this is a great jumping off point to start that discussion and ask them, hey, a very simple question. Do you wear glasses or contacts? Then you can help guide them into an appropriate plan that makes sense for them. Ben, if you go to the next slide. One thing that I think is overlooked a lot is that during a well eye exam, the optometrist can often catch some of these early precursors to other health issues like hypertension, high cholesterol, diabetes. Those can all be seen on a well eye exam. We hear all the time that our optometrists are often the first person to detect those because they went in for an eye exam and that was brought to their attention, and then they went on and saw their PCP and got treatment for it. So it's really important from just a healthcare overview perspective for folks to get their annual well eye exam, as well as just making sure that their vision, where their status is and whether or not they need glasses or contacts. So really, really important question and really important value for their health by getting their annual eye exam. Ben, I'm going to have you go to the next slide. Now, with regard to VSP, we cover 85 million people. We're national. We have a huge footprint across the country. That's all we do. We're a not-for-profit company focused strictly on vision. As far as our network, really easy to find a participating provider on our provider locator tool. And this is just a screenshot of what that looks like. You can look it up by name, by zip code, et cetera. Really easy to find our participating providers. And as mentioned, we have coverage pretty much anywhere across the country, unless they're just in an extremely rural spot where there just are no providers. Our network footprint is huge. And if we go to the next slide, we'll talk about what that looks like. And our network is primarily comprised of independent practitioners, so individual optometrists. We have also purchased VisionWorks, so we have retail locations through VisionWorks, and you may have seen some of their commercials. We recently acquired iMart Express, which is also a retail location, but focused more on rural communities. So this broadened our scope kind of in some of those rural areas where the pockets were a little bit thin. And then we also have a retail option where someone can get their materials and so forth through Iconic. And it's a great tool. They can go on there and do a virtual try-on for some of the frames. They can sync it up with their VSP benefit, and it will actually show the costs of the materials as they're actually shopping on the different for their different frames and so forth. So really great footprint. As we know in healthcare, access and network is critical, whether it's health, dental, or vision. And as I mentioned, with us covering 85 million people nationally, huge footprint, access should not be a problem. Ben, I'll have you go to the next one. Okay, with regard to coverage, we often get asked, is it important for someone to buy a fully insured product versus pay out of their pocket? The reality is when you actually look at the numbers Our average savings for someone buying a program is over $300, and that includes after paying for it. So what happens a lot of times is people go into the office, they get their eye exam, they pick out their glasses, they choose the lens enhancements they want, and then they go to check out and they end up with a pretty significant bill, and they're always surprised at how much it is by the time they pick their materials and walk out the door. So the reality is, by buying a fully insured vision product, most people are saving over $300. So the question about does it make sense to buy a product or just pay out of pocket? The answer is to get coverage. So that's where the savings out of pocket matters. As far as the coverage, it's very affordable. They are state-based rates. So our rates, if you're 18 and over, it doesn't matter whether you're male, female, healthy, unhealthy, whatever it is, it's a state-based rate. You pay the same rate. There's no issues whether you're healthy or not, whether you're a smoker or not, etc. It's very affordable. They can buy the product at any point in the year. It's not necessarily tied to AEP. So they can buy it. What happens a lot of times is consumers are focused on their health. They buy that. They forget about ancillary services like dental or vision. With our product, it can be bought at any point during the year. It's not necessarily tied to AEP. They have the option of paying for the year in advance or paying monthly, but they are committing to 12 months if they do select that. And there is no waiting period to use it. So when they buy it, within about 24 hours, their eligibility information will be loaded in our system, and the optometrist will have access to that. So they could buy it and then in 1 or 2 business days, go use the benefit. So great benefit, easy to use, huge network, and very simplistic to buy. If we go to the next slide. Now, you do have to go to a separate, essentially, landing page or transition page to purchase this. This is not part of the shopping cart experience, and that's because vision is not part of the federal tax credits and so forth, so it has to be separated. But as far as finding it, if you go to the primary website and you look for the Shop Plans dropdown, you'll see some of the options that are available. Click the Learn More box, and then under there, you'll see VSP being under the Vision Care bucket there where it says Learn More. If you click on that, then it gets to our page, and you see the yellow arrows. Those are the things to click on. And the more towards the bottom, you see the yellow arrow pointing at that small font, and that's our actual URL or website. So I have put the actual URL to go to our site on the very bottom. That's the vspdirect.com Kentucky Exchange Welcome. That gets you from the site over to the VSP site to conduct the transaction. But you have to go on the primary site, look under Vision Care, and then under the Learn More, and that will get you to the VSP page. And Ben, if you go to the next slide, I wanted to show an example of what it looks like when they land. So when they come over, you can see the co-branding on there. So a consumer knows this is part of the exchange. I've moved over. I'm still working with a partner of the exchange. And the great thing is it's about a 5-minute enrollment process. Really simple. The consumer simply puts in their zip code and hit the blue See Plans button, and that will bring up the plan options and the details so they can look into that, make a decision that makes sense for them. And again, at the very bottom, I put that direct URL, and you could just type in that URL. It brings you to the exact same spot. So you can navigate it through the page on the exchange, or you can simply go to this URL. You'll land on this spot that you see right now, and then simply put in their zip code and hit the See Plans button. And then, Ben, we're going to show them what those options look like. What you see here is the 2 plan options that are available to consumers through the exchange. And you'll also notice there are the 3 buttons: 1 person, 2 person, or family. The consumer has the option of buying it for themselves, buying it for their spouse, or including their family. So it's essentially a 3-tier rate. And the 2 plan options, right now you're seeing the single or the individual rate for the 2 different plans. And then obviously I couldn't include everything in the screenshot. There's a tremendous amount of detail underneath that if they want to see some of the plan detail information, dig into doing some comparison tools, provider locator, and so forth. Really, really easy to get that information on there. And Ben, if we go to the next slide, I want to talk about the actual plans themselves. So our plans are all what we call 12-12-12 plans, which means every 12 months, every year, the consumer gets a well eye exam, they get new frames, and they get new lenses. And if you've done any work in the employer group space, you'll often see that usually the materials tend to be on a 24-month cadence. So you'll often see, well, they get a well eye exam every year, but the materials are every other year. Or maybe both of those are every other year. These are what I would consider very rich plans because they're every year they're getting a well eye exam, they're getting frames, and they're getting lenses. So really rich benefit, probably better than what they may have had through their employer. And if we go to the next slide, the standard plan is one of our most popular plans within VSP. It's available in all states. And from the perspective of, kind of a low, medium, high, I would consider this a high plan. We've learned from a member satisfaction standpoint, people are happier with richer plans. So we don't go in with a low plan. We usually go in with a medium plan and a higher plan because people get more of the services covered. Their out-of-pocket tends to be lower, and they're just more satisfied with the product. So this does include a $150 frame allowance, or that jumps up to a $170 frame allowance if they pick a VSP branded frame. So more value by buying our products. And when you go into the optometrist, we worked with them to identify the VSP frames. If you've ever been to an optometrist, you walk in and there's racks of glasses. It can be very confusing and overwhelming. We've worked with our optometrists to put our little logo or heart sticker on the frames that are VSP frames so folks know which are those frames and which they get more value for. So even at our entry-level plan, they're getting $150 or up to $170 frame allowance. There is a small copay for the exam and for the materials. And you see some of the numbers around some of the common lens enhancements that folks tend to pick. And of course, they can pick the option of picking contacts if they want to use that allowance towards that. Ben, if you go to the next slide. Our richer plan is the premium plan. It also has a small copay for the exam and for the materials. It has a $200 frame allowance, so that gets them a nicer set of frames if they want it. That jumps all the way up to $220 on the frame allowance if they use a VSP branded frame. And then you see some of the enhancements there, or they can use the contact lens allowance if they are contact lens wearers. So bottom line is, there's a medium and a high option for them. Really great fully insured products that they get every single year. And some consumers will buy glasses one year and then use the next year's allowance on the contacts. But it is either or. They use the 200 towards frames or towards contact lenses. And Ben, let's go to the next slide if we could. Now, from your perspective of sitting down with someone, guiding them through the process, the bottom line is if someone's more focused on saving money, they just need kind of the basics. We'd always steer them towards the less expensive plan, guide them to the standard plan. If you've got someone who really wants a nicer set of frames, have that higher allowance, doesn't mind spending a little bit more, progressives are covered at a very low cost. I would steer them into the premium plan. So a lot has to do with their decisions around finances. Some folks really do want a nice set of frames, so it's worth guiding them that direction. So as you're sitting down helping them, that's one thing I would guide them to. And also you see the sticker here, the look for the heart sticker. As I mentioned earlier, letting them know, hey, you're going to get even more if you pick a VSP brand frame. And we have a ton of frame options there so that they're getting the most for their dollars. And their satisfaction is going to be really, really high with VSP. Then I'm going to go to the next one. We're almost done here. Now, also from the perspective of, what happens after someone purchases our plan, VSP handles all the rest of it. Really simple. They get a welcome packet immediately by email. They don't need an ID card to go see our doctors. The eligibility is loaded immediately, and they can simply give them a call, let them look them up in the system. We do all of the onboarding, lifecycle communications, handle the renewals. For you as an assister or a broker, you don't have to touch it at all. It makes it really simple. And the member experience is very high with that. And if we go to the next slide. Throughout the year, we're going to welcome them. We're going to send them information about their benefits. We're also going to send them information about special offers or additional opportunities to save money. They could buy a second set of glasses at a discount, whatever it might be. We're also going to send them savings statements showing them how much they actually saved by buying a fully insured product versus paying out of pocket. And then, of course, we're going to let them know the renewals coming up, see if they want to continue on with the program and carry that into the following year. So Ben, if we go to the next slide, I'm pretty much done here. One thing I did want to mention is our member satisfaction. As I mentioned, we cover 85 million people. We're a not-for-profit. We are focused 100% on the members' experience and making sure they have a quality experience and a good experience working with VSP. Our member satisfaction is in the 90s. Our renewal rate is in the 90s. So that means 9 out of 10 people are going to have a great experience, are going to renew their products. So for you as someone who's helping someone, it'll be quiet, they're going to be happy, and they're going to have a great experience at VSP. So in closing, first of all, I just want to thank you for your help working with our clients to get us to VSP. Really appreciate it. We wouldn't have the success we've had without you kind of boots on the ground, helping people make great decisions. So thank you very much. Appreciate it. And also to our friends at the Kentucky Exchange, thank you for allowing us to be partners with you and serve the folks in Kentucky for their vision needs. So that's it for me, Ben. Thank you very much. Really appreciate participating.
Amazing. Thank you, Michael. Appreciate you being here as well. All right, that will move us into our third and final section for our issuer presentations, being our standalone dental providers. And I will ask Michelle to come back on for a third and final time to talk through Anthem's offerings.
All right. Thank you, Ben. Okay. To review our dental offerings that are on the exchange, I do want to point out that while there are 4 plans that we will look at here for available for the members who are shopping on Connect, there are additional dental plans. I believe there are another 4 not included here that are a little more comprehensive or other benefits available for those who are not shopping on exchange. So if there are agents on the call and you have people who are not purchasing their medical through Connect, there are vision or dental plans that are available directly through Anthem off the exchange. But for the purpose of today, I know we have a lot of connectors joining us, so I do want to make sure that we walk through just a little bit about the dental plans that are available through Connect. So unfortunately, I hate that this slide is a little out of order in terms of the benefits themselves. If I could reorder them, I would put the preventive plan first up there so that Anthem Dental Preventive is going to be the leaner, most cost-effective of the 4 plans. It does have preventive care only for adults. There are cavity fillings, other minor benefits that are included for children under 19 on the preventive care. But for adults, just know that while it is the lowest cost option, it does only have coverage for the preventive dental benefits for adults. The value plan would be the second. So that's the top one on your screen here. That's going to be with a $450 max out of pocket and 50% coinsurance on in-network services. It is a little richer than the preventive care option in that minor services like fillings, cavities, and other benefits are included for that plan. And then the next would be the Anthem Dental Family, which is yet another level of coverage added. So in addition to preventive and minor, you will see some basic services like endo and perio that are covered on the Anthem Dental Family plan. And then the Dental Family Enhanced has a very similar benefit structure. You'll see on the right-hand side here that with the same $450 pediatric max out of pocket and then a $50 pediatric deductible. There are covered services for both minor, major like endo and perio, and also adds orthodontic coverage for children under the age of 21. It is not covered in full ortho, but it's the only individual on marketplace dental plan that does offer some ortho coverage for children with a $1,000 ortho max benefit and 50% coinsurance. Next slide. I thought there was a couple other things on the dental there. So I do want, someone asked in the Q&A about pediatric dental. So I want to point out that that has been removed for 2026. That pediatric dental benefit is removed from the medical benefit. So in years past, for many years, both pediatric dental and vision were embedded in medical. In 2026, your pediatric vision remains embedded in the medical plan. Pediatric dental does not. So being familiar with these 4 on exchange dental plans will be probably imperative for members who need dental coverage, particularly for their children. They will need to enroll in, at minimum, one of the dental preventive plans, since that will not be embedded in 2026 for those medical plans. And if anybody has any questions about that, just drop it in the chat, and I'll try to explain it a little further. I will say we have a wonderful one-pager that's kind of a product grid chart for those 4 plans we talked about: the preventive, the value, the dental family, and the enhanced, that I can easily shoot over to Ben or whoever would need that to get over to the connector, so that you have a really quick reference guide when you're trying to help members choose between the 4 dental plans. So I'm happy to send that over as well. That is all I had today. It was a great pleasure talking to you all 3 different times. So thank you again for your attention and your time.
Yes, thank you, Michelle. All righty, looking up next, we've got Best Life as another standalone dental provider. So Jay, over to you.
Hi, Ben. Thank you. My name is Jay Smith. I am the Director of Claims and Customer Service here at Best Life. I appreciate being here today and present some of the information on Best Life. Next slide, please. Just agenda for the slide. We don't have very many slides here. We probably will expand those next year to be able to give more information. I'll just give a quick overview of Best Life and Health, who we are. I did list 2025 changes. Since there was no presentation last year, I do want to outline some of the changes that we made last year that will continue into the 2026 year. We'll take a look at the various plans that we offer and our PPO network. And then talk about customer service contacts, our claims processing, and things like that. Next slide. We are Best Life and Health. We've been in business a little over 50 years, actually 55 years. Our primary history has been offering dental, life, vision, short-term disability products to employer groups. But since the fall of 2013, with the first open enrollment, we have offered our dental products on the exchange marketplaces, the FFM and various SBEs. We're currently offering in 32 states in the Washington, D.C. We are headquartered in Southern California, but our customer service and claims department, our operations area is basically located in the Boise, Idaho area. Next slide. 2025 changes. These are changes that some of the things that we changed beginning as of January 1st of 2025. We're going to continue those changes into 2026. And we also have a couple of items specific to 2026. Couple of things. We are offering, obviously, individual dental plans. We're an SADP. But we also offer, starting in 2025, each of our 4 supplemental adult plans, we added an accident benefit. And depending on the level of plan that is chosen by the client, by the prospective member, you can have anywhere from $100 to $500. This is a benefit in addition to supplementing the dental plan itself. For example, a superior plan, if there is an accident that damages a tooth, that $500 will be offered as a benefit before any coverage is used from the standard dental plan enrolled in. That $500 is There's no deductible. It's covered at 100%. It's basically a $500 benefit on top of the benefit of the dental plan that the member enrolled in. Also in 2025, we started offering a vision discount. This is not insurance per se. It is a discount plan, and it's offered through the IMED, one of the IMED networks, a national network. Basically, it gives some discounts. Discounts are available to members on exams, frames, contacts, lenses, things like that. Fairly good discounts. There's more information online about that as the member kind of looks at our brochures, and we'll talk about that in a minute. In 2026, one of our 4 adult plans, we are increasing the annual maximum the plan will pay from $1,000 to $1,250. That was something that our customers told us frequently to increase that, so we did. And also the pediatric plan maximum out-of-pockets are increasing from the 2025 year, and we'll see that on the product review slide. Next slide, please. This is our product review slide. Basically what this is saying, this is a busy slide. This is a very high level coverage of each of our 4 adult supplemental plans, and we have 2 pediatric dental plans. If you look at the chart below labeled pediatric, you will see, for example, Best Life Superior and Best Life Preferred. Those are the same benefits. On the pediatric side, identical benefits, identical plan, and those are the plans offered with the supplemental, the adult superior and preferred. Same issue for the essential value and the essential basic. We have one lower pediatric plan that applies to our two value plans. You'll see the superior and the best life have the highest calendar year maximum available that the plan will pay, anywhere from $1,500 to $1,700. Whereas our essential value and essential basic have a lower maximum the plan will pay for covered services. Obviously, there's a premium differential in there. Best Life Preferred, I did want to point out that plan, we started that plan on January 1 of 2025. The calendar year maximum that the plan will pay was listed as $1,500. For those members that are returning to us with that same plan, re-enrolling in the preferred, their second year plan will cover up to $1,600, and then in year 3 at $1,700. So it's kind of a self-increasing plan design that we have there. I don't think I'm going to go through all of the coverages, but what you do see here is you see individual and family deductible information, and the percentages that you see for each of the covered categories is the member cost. So for example, Best Life Superior under the adult plan, basic services are basically preventive diagnostic, the 6-month services that somebody would go see their dental provider for. If they see an in-network provider, they don't have, that coverage is at 100%, the member has no cost. If they're out of network, they could pay up to the 20% of the cost. We always encourage our members to seek a preferred provider simply because it can lower out-of-pocket costs. I won't go into too much detail there, but I will say that when a prospective member is enrolling within the website at time of enrollment, there is a link to a brochure for each one of these plans that give a lot more detail as to what the coverage is. I always encourage everyone to take a look at those brochures because it really gives a lot of information and helps that member make a decision as to what's best for them and for their particular circumstance. Next slide, please. PPO network. All of our members are have access to two national networks, Dynamax and Connection Dental PPO USA. Connection Dental PPO USA is also now known as GEHA, G-E-H-A. But the dental provider community still knows it as Connection Dental. Dynamax shows 263 access points or dental locations nationwide, where very similar amount for Connection Dental. So these are extensive national networks that I want to point out. I wanted to list nationwide in particular because our plans are not limited to coverage with providers just in Kentucky. Any member can go anywhere in the United States and have covered services from a provider. Kentucky itself, you're generally looking about 3,000 for each of these provider networks. You're looking at about 3,000 statewide access points, locations. So it's fairly extensive in each state. Kentucky's no different. There is coverage for out of network. If a member can choose any dental provider that they would like to see. So if they have a long-term dental provider and that provider is in or out of network, they can still gain coverage. They still have coverage with their plan if they continue to see that provider. But again, we always encourage people to select a network provider if they possibly can, because it will lower their out-of-pocket costs. Next slide, please. Our customer service is available from 8 a.m. to 8 p.m. Eastern time. Phone number and email is listed there. One thing I do want to say about the customer service is one of the things that we pride ourselves on is when our customer service number is dialed, there's going to be probably more than likely 2 selections that the customer would have to make before they actually speak to a live customer service representative that is, again, based in the southwestern Idaho area. So there's not a lot of interactive voice response. There's not a lot of back and forth with a computer. You're actually talking to a representative who can help best. We do have services online also. Person can make payments. They can give their account status, plan benefit information through our brochures that I mentioned previously. They can also get claim status through their online portal. And obviously what is not on the slide is they can do a provider search to see if their current provider is in network, or any provider that they may seek. That search capability is by zip code, by specialty, whether they're taking a new patients or not. There's a variety of search criteria that is there. And again, I want to say again, because it is important, that when the member is enrolling, there is brochure availability for each of the plans. And we always encourage everyone to take a look at that brochure. If there is a question, just email us, call us. We respond very quickly to both. And we should be able to answer any and all questions that any of your clients or yourself may have. Next slide. As far as our claims processing goes, we accept electronic or paper claims from our providers. We also select or take claims from members themselves. There are times that dental providers will not bill insurance companies. It's rare, but it does happen. But a common question from our membership is whether they can submit a claim themselves, which of course they can. We process claims within 5 business days, pretty much without exception. We're pretty quick in that. And an explanation of benefit form on every process claim is mailed out to the provider and the member. We also can accept a predetermination of benefits. A dental provider or a member can certainly send us a request for coverage information on proposed services. And and we would send out the same explanation of benefit form so they can make an informed choice and decision before those services are done. They would know their out-of-pocket costs and things like that. Next slide, please. That wraps up my presentation. And again, we will hopefully we'll be able to do this next year, and we'll be able to expand on the presentation itself and give some examples of the brochures and give some more online information, things like that. But thank you for allowing me to present. Ben, I appreciate the time. Thank you very much.
Absolutely. Thank you, Jay. And if anyone has any questions, feel free to throw those into the Q&A box there for Jay. But thank you for your presentation, sir. All right, looking up next, HRI Dental, our third and final SADP or standalone dental provider. And here we have, I believe, Ashton presenting.
Hello, good morning.
Good morning.
So with HRI Dental, what might be listed on the, or what is currently listed on the Kentucky marketplace is Paramount Dental. So I just wanted to, this is our going to be our second year, and we went through an acquisition in the at the beginning of the year. Uh, with that came along a name change. That HRI name was we're actually going back to our roots with that name. We have been an issuer based out of Evansville, Indiana, for the last 35 years. And moving back to our roots, we adopted that HR name back. So we are a dental and vision issuer. We offer small and large group commercial products in Kentucky, Indiana, and Ohio, and then also on those marketplaces as well. And like I said, our inaugural year was this year. Learned a lot about some of the needs in the dental sphere from Kentucky individual, and we're looking to expand on that in the future. Next slide, please. So we have three plans: preventive, essential plus, and total care. Uh, with all of our plans, preventive and diagnostic, our services are covered at 100%. We are an in-network only plans. All of our plans are EHB compliant for pediatric ages, which in Kentucky is under 21. And then you can see here the breakdown between basic, major, and also our plan annual max for those three plans. With preventive, obviously you're only going to get the diagnostic and preventive services covered, but with the essential plus and total care, you'll see additional services covered, fillings and crowns as well. Next slide, please. With our network, it consists of our proprietary network as well as a leased network through Connection Dental and Dentamax. This is Connection Dental and Dentamax are national leased networks, and so we have access points across the country. With that, we have great coverage across the state of Kentucky, meeting much of the network adequacy standards in Kentucky. You'll see that sometimes specialists are limited in rural areas just because of the lack of availability of those specialists. But members can see any provider within our network. Next slide, please. And so this is a really a slide packed full of information, but this is what our summary of benefit looks like across our three plans. With those basic and major services, you'll see waiting periods that are for the Essential Plus and Total Care plans. You'll also see on the bottom medically necessary pediatric orthopedic or orthodontic. We have teledentistry coverages, so that allows our members to have 2 visits per year, and that teledentistry is through the teledentist online, which is a great added service to what we provide already. Next slide, please. As far as tools and resources go, we utilize the JET platform, and so that gives our members a good opportunity to see the documents within a single portal where they make payments and can make any kind of changes regarding paperless settings. We also have a dental portal on our website, which is insurancemiles.com. Where members can find value adds and also search their explanation of benefits and any kind of benefit history that they have. Our call center is located in Evansville at our headquarters. And we're open 7 a.m. until 7 p.m. Monday through Fridays. We also have multilingual and Spanish speaking specifically representatives as well. And the points of contact, again, my name is Ashton. I would be the primary point of contact with any kind of questions regarding our dental products in Kentucky. And I'd be happy to answer any further questions if you place them in the Q&A.
Thank you, Ashton. Appreciate it. And
Appreciate
again,
it. Thank you, everyone.
thank you. And if you all have any questions, please feel free to throw those into the Q&A, and our panelists will look at those and address those for you. And that will bring us to the third, or I guess fourth and final section of today's presentation. Just a quick closing survey for the group. 2 questions to assess. First here being, on a scale of 1 to 5, how effective was this in helping you understand each issuer and the available plans for 2026? So let me get this launched here to your screens now and give you all about a minute or so here to answer this question here. We'll have a second one here momentarily. And while our Agent Connector attendees answer these questions, panelists, anything anyone wants to add from what they've seen in the Q&A or anything else at all from anyone on the call?
Ben, this is Michelle with Anthem. I did think of one thing I wanted to add, if that's okay.
Yeah, absolutely. Go ahead.
Okay. When we were discussing the Pathway HMO network and then the Pathway Transition HMO network, this is not brand new for 2026, but I think it's important as a reminder to particularly let agents and connectors know that the Lexington Clinic in Lexington, Kentucky, they have joined our Pathway HMO network as of January 2025. We did announce that, but I think it's always worth repeating because it was a big point of contention for several years as far as the Lexington Clinic not being in our Pathway HMO network. So there were lots of members who may have even made other decisions based on that. So with CareSource exiting, I want to make sure everyone is comfortable with the fact that if you have members who see Lexington Clinic providers and you are selling or illustrating for them a Pathway HMO plan, the Lexington Clinic is a participating provider there. They are not in the Pathway Transition HMO, however.
Thank you for that, Michelle. Great call out for our Lexington residents and local residents there. All righty, thank you, everyone. I'm going to close this poll out now. Let me share these results with the group. Looks like let me see if I can do my math, 87% finding this either effective or extremely effective in understanding those plans available for plan year 2026. So thank you all for participating there. Our second and final poll question is similar, but want to make sure that we are addressing the needs of you all and as you help interact with residents, being on a scale of 1 to 5 after attending today's presentation. How prepared do you feel to help residents enroll in health coverage? 1 being extremely prepared or 5 not prepared. So let me launch this to your screens as well, and again, give you all about a minute or so to help to answer this question here. And after making your selection, as you all have any sort of outstanding questions, feel free to throw those into the Q&A box there for our panelists to look at. About 30 more seconds here for this second and final poll question. Alrighty, I will close this out in about 10 seconds if you haven't yet made a selection. And we will close this one out as well. And again, share those results. Again, here about close to 70% feeling extremely prepared or prepared. So thank you all for answering these 2 questions and participating with us today. So that concludes today's presentation. Thank you all for your time, to our panelists for your time and commitment here to share your plans and offerings with our agent and connector community, and to our agents and connectors for sparing some time with us this morning to learn more about those plan offerings for plan year 2026. As we have mentioned earlier, I know it's a busy time of the year with open enrollment right around the corner. So appreciate you sparing us some time today, and want to make a quick plug for our session tomorrow, which will be with our MCOs. So if you haven't yet registered for that, please do so and attend that one as well if you are so interested. As always, you can reach out to the QHP program inbox. That's khp.program@ky.gov if you have any sort of additional questions or support needs. And also want to make a plug for the QHP website as well. As we mentioned earlier, lots of various resources for you available to you at your disposal, not only throughout the year, but maybe even more importantly so during open enrollment. So be sure to check that out as we continue to post updates there, new training materials, updates as it relates to any sort of federal changes, so on and so forth. We're here to support you in open enrollment and throughout the year, so stay in contact or reach out if there's anything you need, and we will hang on here for a few minutes and see if there are any sort of outstanding questions from the group here. And again, please don't use that raise hand feature. Throw those into the Q&A, and we can try and help address those for you. Panelists, anything that you've seen come through the Q&A here that is worth voicing over for the group?
A question about the slide deck. We'll get the slide deck up on our website by the end of the week. Look for it in the Friday Facts.
Absolutely. Yeah, this will be
This is good
sent
stuff.
out to you all for your ongoing reference as well. Michelle, I see that you want to answer Joyce's question verbally. You want to take that one?
I actually did not mean to hit that button. I was trying to type my answer, but I will go ahead. Yes.
Yeah.
Joyce asked, I've run into many rural hospitals not taking Anthem transition plans. Has that expanded into many rural clinics? So the Pathway Transition Network is by design a narrower network of hospitals. You will primarily only see docs in the University of Kentucky, University of Louisville, as well as St. Joseph in that network, and the providers that are owned by them, for lack of a better term. So no, to answer you will not see many of the smaller hospitals in Pathway Transition. However, the Pathway HMO, the full network, that is available in all 120 counties. That does have every single hospital in the state in the network, including ARH, any of the smaller hospitals out in Western Kentucky, Central Baptist. So that would be the plan you need to direct those members to if they are needing access to a hospital in a smaller area.
Thank you so much, Michelle. Alrighty. Seeing our questions start to slow down here, we'll stay on for about 5 more minutes here in case anyone has any sort of outstanding questions. But if anything comes up after the presentation, of course, you saw those points of contact for each of the participating issuers, so you can email them or, of course, the program inbox as always. And if you have no outstanding questions, please feel free to drop. And again, want to thank you all for your time this morning, and hopefully be able to see you all tomorrow morning as well for our MCO presentation. If you all do have questions, please feel free to throw those into the Q&A. We'll not seeing too many come through, so we'll stick around. Probably cut us off around 11:10 Eastern time. So if you do have anything, please feel free to throw those into the Q&A box. righty, team. I'm seeing our numbers slowly dwindle and nothing coming through the Q&A. So really want to express our gratitude to our panelists for joining us today and then participating, and to our agents and connectors for hopping on the line as well. I appreciate your all's time and contributions and for all the work that you do throughout the year. So thank you, everyone. Please feel to reach out if you have any questions or need anything else. But thank you, and hope you have a great rest of your week. Thanks, everyone.